Good afternoon, everyone. My name is Lisa Ansell, and I am the Director of Academic Programming at the USC Kasdan Institute. On behalf of the USC Kasdan Institute, the USC Leonard Davis School of Gerontology, and the Jewish Community Foundation of Los Angeles, it is both an honor and a privilege to welcome all of you here for today's most important and timely event, Honor Your Father and Mother, how the Jewish community can support our senior citizens in Los Angeles in a climate of housing insecurity, food insecurity, and rising healthcare costs. The Jewish Community Foundation of Los Angeles manages charitable assets of $1.5 billion on behalf of 1,400 client families and is the largest manager of charitable funds for local Jewish philanthropists. Established in 1954, the foundation partners with individuals and families to amplify the impact of their giving and ensure a strong, resilient Jewish future. Over the past decade, it has distributed $1 billion to thousands of nonprofits across a diverse spectrum. We are so grateful to partner with the Jewish Community Foundation of Los Angeles to present this program today. We are here today out of a profound sense of responsibility rooted in Jewish values, honor your father and mother. This is not just a commandment. It is a guiding principle that calls on us to ensure dignity, safety, and respect for our elders. Yet, as we look around our city and our nation, we must confront the challenging paradox that shapes the lives of many older adults today. On one hand, America's seniors collectively hold the majority of the nation's wealth, owning the vast majority of real estate, stocks, and other assets. On the other hand, many older Americans are among the most vulnerable when it comes to housing insecurity, predatory financial practices, such as student loan debt incurred later in life, ageism in the workplace, food insecurity, and the ever-increasing cost of healthcare. This contradiction is especially stark in Los Angeles, where the gap between wealth and vulnerability is often defined by more than just age. When we consider the additional layers of gender, ethnicity, and race, the challenges become even more acute. Women, people of color, and those from diverse backgrounds often face disproportionate hardships, compounding the risks associated with aging. In Los Angeles, a city celebrated for its diversity, these disparities are particularly visible and demand a community-wide response. Today, we are honored to welcome a panel of distinguished leaders and experts to explore this topic. While each of our panelists will be shortly introduced in greater detail, we are joined tonight by Donna Benton, Director of the USC Family Caregiver Support Center, Diego Cartagena, President and CEO of B'Tzedek, Wendy Goldman, alumna of the USC Davis School of Gerontology and founder of GeroBiz Consulting, Ellie Weitzer, President and CEO of the Jewish Family Services of Los Angeles, and Carly Roman Wu, Program Officer of Archstone Foundation. We thank all of you for sharing your wisdom and guidance with us on the overlapping crises that our senior community faces. We are likewise honored to welcome Maria Henke, our moderator for today's program. Maria is the Senior Associate Dean of the USC Leonard Davis School of Gerontology, and we look forward to hearing her thought-provoking questions and analysis today. As we begin our program, let us reflect on our shared values and the unique strengths of the Jewish community. Let us also commit to action, working together to ensure that all senior citizens in Los Angeles can live with dignity, security, and hope. Thank you for joining us and for your dedication to this vital cause. Now it is my great pleasure to welcome Lou Groner, Vice President of Community Relations at the Jewish Community Foundation of Los Angeles, to offer introductory remarks and to commence our program. Welcome, Lou.
Thank you so much, Lisa, for your very warm welcome. We at the Jewish Community Foundation of Los Angeles are proud indeed and delighted to sponsor this very important conversation, very important and very timely conversation. This is one of many such Kasdan events that we have sponsored over the years. And the reason we do it is because, in our opinion, the Kasdan Institute is the premier presenter of topics of importance to our community. Lisa, I commend the work that you and Stephen Ross and the Kasdan Institute are doing to bring these conversations to the forefront. No one is really doing quite what you all are doing in the high caliber fashion that these conversations are held in. Likewise, there's really no organization in town doing quite what we at the Jewish Community Foundation are doing. And to help explain what we're all about, there's an ad from an ad campaign from years ago, and the headline goes like this: if you think earning money is hard, try giving it away. That kind of captures the essence of why we exist. Charitable giving can oftentimes be a complicated, cumbersome, and confusing process. How do you know who is best in class to support a particular area that you're interested in? How do you know they're doing what your funds are supposed to be doing? So that's why over 1,400 donor families and individuals have joined together to conduct their philanthropy through the foundation and make a powerful charitable difference in our community. People create charitable funds with us, what's called like donor advised funds or endowment funds, to make a real difference in the community. And you could too, if you're interested. And I'd be happy to talk with you afterwards to share more details about how it all works. I'd like to just take a moment to acknowledge the life and the passing of our former president and CEO, Marvin Shotland, who just passed away several weeks ago, who had led the foundation for 33 years. He joined us in 1989 when we were a $90 million foundation, and he left 3 years ago. He retired. And at the time he retired, it was a $1.5 billion foundation. So the reason we're able to do what we're able to do today and give the grant to the Kasdan Institute to make this possible and so many other grants is because of the vision of this one person and the hard work, Marvin Shotland. So may his memory be a blessing. It's ironic that just yesterday on Shabbat, the Jewish Sabbath, the weekly Torah portion that was read in synagogue happened to be one of the most awe-inspiring chapters in the Torah. There was even a movie made from this chapter. Moses receives the Torah and the Ten Commandments. We just read it yesterday in synagogue, in synagogues all over the world. And as everybody knows, honoring our parents, in Hebrew, kibud av va'em, is one of the Ten Commandments. Would anybody venture to guess what number on the list of 10 commandments is honor your mother and father? Anybody want to just throw out a number? One. One? It's actually not one. Five. Okay, very good. It's number 5. It comes right after the commandment to observe the Sabbath. And right before number 6 is do not murder. Do not murder. So think about that for a minute. The commandment of honoring our parents, of supporting our seniors, of helping the elderly comes before do not murder, right? Think of that. It's really, it's in the middle of the commandments, and it's the very core of the essence of the Jewish people. It's like the balancing act upon which all other Jewish values rest on. So, honoring our parents, taking care of our seniors is indeed a holy mission. And that's why this conversation is so important. I'd like to thank the USC Davis School of Gerontology for also helping to make this possible. And I would like to invite Maria Hinke Senior Associate Dean of the University of Southern California's Leonard Davis School of Gerontology, to introduce our panelists and begin what will most definitely be a very engaging and enlightening conversation. Thank you very much and enjoy.
Thank you all so much for taking time out of your day to share this important discussion. Economic security issues in older adults is very important to many of us at USD, and we are grateful that you share that interest. We're also grateful to Neil Steinberg, the president of Generation Entertainment, who has agreed to let us begin this afternoon's conversation by watching a clip from his recent documentary film, Aging in America, Survive or Thrive. This documentary examines how the experiences of aging in the United States has changed over the last 50 years and what those changes reveal about our social priorities, public policies, and systems of care. If you're interested in watching the entire film, it's available on PBS. Just Google it. The documentary was inspired by a publication by Dr. Robert Butler entitled Why Survive Being Old in America. And it was published in 1975 and considered a seminal text in gerontology. Coincidentally, the USC Leonard Davis School of Gerontology is celebrating its 50th anniversary this year as well. And when the book came out and the NIH or the National Institute on Aging was created and the school opened, it looked like a very promising time for aging and older people in the United States. So let's watch a little bit of the film now and let's see how far we've come, and we'll talk about it after.
You have to keep in mind that today's children will one day be older people, and today's older people once children. There's a unity and a continuity to life, which we must bear in mind. And when we are negative towards old age, we're slashing our own tires. This is really our own future we're talking about.
Half a century ago, Dr. Butler wrote a Pulitzer Prize-winning book, Why Survive? Being Old in America. This landmark work was a call to action to address the issues of older Americans. 50 years later, how far has our nation progressed in its treatment of our longest-lived citizens? When Dr. Butler wrote Why Survive, there were less than 23 million Americans over the age of 65. Today, there are over 55 million, and yet the issues he identified, including our attitudes towards aging itself, still persist.
A number of years ago, in 1967-68, I began to use the term ageism in America. By ageism, I meant age discrimination. And I adopted it as analogous to other terms that related to prejudice in America, racism and sexism. So it seemed valuable to me to introduce a new term, which is now widely used.
There's this thing called age, and it sucks.
We can still be 80 years of age and do things that maybe we thought we could only do when we were 60 years of age. But inevitably, health issues, chronic conditions, mobility limitations, these things are part of the natural evolution. How do we keep from stereotyping persons that happen to be older, have a walker, they're in a wheelchair, they're using assistive devices? How can we get the public at large not to fear growing older with a limitation?
One of the most significant forms of ageism occurs in the workplace.
Whenever I'm asked by a search firm to make a suggestion for somebody for a major leadership role or to serve on a board, the first thing out of there, we want a young, dynamic person. And those two words go together, young and dynamic. They never say we want an older, more experienced dynamic person. And why those three words don't go together, that's ageism.
You know, I think the damage of ageism is certainly losing the value and the wisdom that older people bring into the workplace, the experience of just their work history and working alongside younger generations who are skilled in the use of technology, I think is a great thing.
One of the great benefits of extended lifespan, and I'm 75 years of age, I'm really starting to understand at this ripe old age, is that we can have new roles to speak loudly for those things that are over the horizon, just as Robert Butler was doing 50 years ago when he looked over the horizon and realized that ageism was keeping us from being the best that we could be.
For the economically insecure older person, misfortune or unexpected adversity can dramatically alter their lives.
So in this time, people were really amazed about how my resilience and the bounce back, but it's like no one ever asked my story from the start. My mother was brutally murdered when I was 8 years old. My mother was killed by my father. Everything happened really fast. The home I knew was home. It's no more. I'm sent away to strangers. No contact from my mother or dad's side of family. So I had to kind of figure everything out as a child on my own. So I went and got education in nursing. So life is good. Everything's going well, I have good savings, but this thing called cancer comes and takes it all. There's no such thing as personal savings when you're a cancer patient, because it leaves you depleted with nothing, emotionally, financially, physically drained. And my attitude is just keep pushing, keep pushing, keep pushing.
Let's be frank. Doctors don't get paid for keeping you healthy. Hospitals don't get paid for keeping you healthy. The disincentives are powerful. It's really when you're sick that you make money as a doctor and as a hospital.
The problem for older people is that America's healthcare system was designed for the acute care needs of the young, rather than the often more complex chronic diseases of older adults.
Back in the 70s, there was no specialty of geriatric medicine. One of the main influences for me was reading Robert Butler's book, Why Survive? It was one of the few places that really pulled together kind of what I was seeing as a young physician and did it in a very compelling way.
In 1982, Dr. Butler founded the first Department of Geriatrics in a U.S. medical school at Mount Sinai in New York City.
Sadly, the field of geriatrics has never really taken off the way Bob Butler envisioned that it would, and many of us hoped that it would.
There's less than 7,000 geriatricians in the U.S. right now. I mean, contrast that with over 60,000 pediatricians. You know, it doesn't match up with the whole population aging. Our health systems have not prepared for an aging population and the issues that come along.
The Division of Geriatrics at the University of California at San Francisco has developed innovative approaches to address these challenges.
We currently do not have enough geriatricians to take care of all the older people in this country, right? So we absolutely have to train other disciplines and specialties, the basic principles of geriatrics.
What's really needed is an interdisciplinary team. We need nursing, we need social work, we need pharmacy, we need occupational and physical therapy. And together, that can really form a much more effective and cost-effective team.
One of UCSF's innovations is an emergency department that is expressly designed to serve older patients.
So in terms of the geriatrics emergency department, we actually call it our age-friendly emergency department. And how it works is, well, again, it was because people would come in, especially folks who have dementia or have other complex medical illnesses, and they were not getting the care they needed in the emergency department.
An age-friendly emergency department is a state of mind, not a place. If you think about coming to an emergency department, nobody likes being there. Nobody wants to be there. It's really somebody's worst day. You need help getting on the bus. And it's even harder for older adults who have impairments with hearing or vision, or they don't have their caregiver with them. We'll help you. What makes age-friendly emergency departments different is that they have distinct protocols and policies to care for these vulnerable patients in a completely different way.
So I'm going to have Anna, our nurse practitioner, come talk to you, okay?
Okay. So there's differences in nursing homes based off of their ownership. And what we've seen in the literature is nursing homes who are for-profit, they are more likely to have fewer staff and more likely to deliver poor quality of care to their residents when compared to not-for-profit nursing homes.
Let me start by saying that not every for-profit nursing home is terrible, and not every nonprofit home is superlative. However, most of the time that is the case. And the reason is that if somebody is running a nursing home to make money, then there is an inherent conflict of interest between the amount of money that they're going to put into providing high-quality care and the amount of money that they're going to put into their pocket.
The ultimate challenge for nursing homes is how to provide comprehensive care for those who have highly complex medical illnesses, serious cognitive and functional impairment, and who need support for the basic activities of daily living.
One thing that's hard to escape from when we're talking about nursing homes is that people don't want to be there by and large. So when you ask people where they want to be, where they want to receive care, nursing homes are often seen as a last resort. And that is because of a fear, which is sometimes, and all too often, a reality, that people feel isolated away from the community in nursing homes, and that's still true.
The nursing home system in 5 to 10 years from now is completely unsustainable, both because of the massive number of older adults reaching not the age of 65, but the age of 75, 80, and 85 is growing exponentially. The dollars that are going into the long-term care system can't possibly provide for all of the people that are going to need long-term care. We spend a fortune of money in long-term care, and we're absolutely spending it in the wrong place. The amount of dollars that go to nursing homes to take care of people who are below the poverty line on Medicaid could be much more beneficially used if they were reallocated to allow people to stay at home longer, to convert other kinds of buildings into affordable housing with services, and to make the essential nursing home industry obsolete.
What I wish for in our long-term care system is that we could start over, that we could create a long-term care system that absolutely includes institutional care for people who need 24-hour hands-on supportive care, as well as a very robust home and community-based services sector that is accessible anywhere you live in this country.
There's no doubt that we all want to remain in our own home for as long as possible. And I think that older people, having created the infrastructure for us, having created the society that helped finance much that we enjoy, we have a certain intergenerational compact, which we owe to them every effort we can make to make it possible to stay where you want to stay.
I do believe we need a new social movement on behalf of aging and the lifespan, not on behalf of older persons per se, but on behalf of what can we do to have a better quality of life as we live longer.
We are the beneficiaries of the greatest possible gift, time. Time to spend with family and loved ones, time to learn and grow, and time to even reinvent ourselves. The challenge is to create an age-friendly society where everyone can enjoy and find purpose in those extra cherished years.
We spent the last 100,000 years trying to make old people, and now we're doing a pretty good job. We call it a problem. Maybe we ought to be thinking more, as Bob Butler would and did, about what are the potentials, what are the contributions, what are the opportunities that will surface as we have more and more long-lived men and women.
Imagining a more and equitable world for older adults is not just for those who have currently reached the age of maturity, but for the future generations who will succeed them.
Could you just tell us when that film was made?
It was released in May of 2025. So, what did you think?
It's outstanding.
I want to introduce, but first I want to thank Wendy Golden. She arranged for us to have that clip and got permission, and so thank you, Wendy, for that. We really enjoyed it. Wendy is the founder of GeroBiz Consulting, which is designed to address critical issues facing older workers. Wendy advocates for the rights of those who may be experiencing age discrimination in the workplace and are not given equal opportunities due to the stereotypes about older people, which you heard discussed in the film. Prior to this, she was a management consultant. She worked in broadcast media, which I did not know, and qualified pension administration for Los Angeles entertainment companies, and where she observed numerous cases of age bias. Her experience includes litigation, consulting, and financial services, insurance, and entertainment industries. And Wendy is a member, in addition to all that, she's a member of her community emergency response team and leads her local neighborhood watch group. But to my favorite part, she holds a Master's of Business Administration and a Master's of Science in Gerontology from the University of Southern California. Go Trojans. And we won't hold it against her, but she got her bachelor's degree from UCLA in economics before she saw the light. Our next panelist is our very own Donna Benton, who's a professor of gerontology right here at the USC Leonard Davis School. She is the director of the USC Family Caregiver Support Center and the Los Angeles Caregiver Resource Center. She has over 30 years of experience in providing direct service, advocacy, and programs for families caring for persons with dementia, and I can attest that she is dynamic and experienced. Donna was appointed to the California Master Plan for Aging Stakeholder Advisory Commission and the California Commission on Aging. Her research focus is on the development of online evidence-based interventions for family caregivers to improve mental and physical health and well-being and prevention of elder mistreatment. She received her graduate training in clinical psych from the California School of Professional Psychology and was a geropsychological postdoctoral fellow at USC Rancho Los Amigos Medical Center. And then we have Carly Roman Wu, who is a program officer at the Archstone Foundation. Carly leads work within the Foundation's Equitable Coordinated Care portfolio with a focus on advancing equity in aging through the organization's Justice, Equity, Diversity, and Inclusion Principles, or otherwise known as JEDIs. Right? Carly also supports grantees and partners in strengthening care systems for older adults and caregivers with an emphasis on technology, strategic collaboration, and care coordination across health and social services, and helps guide the Foundation's capacity building program by supporting organizations to enhance their effectiveness and long-term sustainability. Carly received her PhD, it seems almost yesterday, from the USC Leonard Davis School of Gerontology, and she has a BA in psychology from the University of Pennsylvania. I am also pleased to introduce Eli Weitzer, the President and CEO of Jewish Family Services Los Angeles. Since 2018, Eli has led Jewish Family Services through a period of program expansion, enhancing their safety net services, homeless prevention programming, and services to older adults. At Jewish Family Services, he's the Director of Strategic Initiatives and Business Development from 2010 to 2014. He also developed and launched several initiatives integrating the organization's behavioral health and social services within the healthcare sector, as well as launching their acclaimed home care agency, JFS Care. Prior to this, Eli served as the Chief Operating Officer in Los Angeles, Ventura, and Orange counties. Eli led Prototypes through a merger with HealthRight 360 based in San Francisco, building the foundation for a statewide $100+ million integrated health and behavioral health agency serving many of California's poorest and most marginalized individuals. He's also a board member of the National Network of Jewish Human Service Agencies and graduated magna cum laude from Brown University with a degree in development studies. And next, I am very pleased to introduce Diego Cartagena. Diego is the president and CEO of Bethzetic. Diego has focused his entire legal career on addressing issues of access to justice. As a former Equal Justice Works Fellow and teen advocate with the Los Angeles Center for Law and Justice Teen LA Project, Diego helped give low-income teen mothers and fathers a voice in court by providing them with legal advocacy and outreach to the areas of family and immigration law. Under his leadership, Bethzetic has increased clinic participation opportunities for both law firms and in-house legal department volunteers, and launched a number of the organization's flagship programs, including Preventing and Ending Homelessness Project, Bethzetic's Rapid Response Family Preparedness Program, and the Harbor UCLA Medical Legal Partnership, as well as the SSI Advocacy Project. Diego is a double Bruin. He has received his BA in American Literature and Culture from UCLA, as well as his JD from UCLA's Law School, where he concentrated on critical race studies. So can you give our panel a hand? Okay. So I think, let's see if I can just pull a chair over here so I can see you all. And I wanted to start out with a question that I would like Eli to answer. And it's a big question that will frame the rest of our discussion. How do we take the commandment of honoring our father and our mother from a family level to the community?
I'll just hold it like this. Can you hear me?
Yep.
First of all, thank you all for joining us, and those on Zoom, thank you for joining us. You know, it's an important question, and I think it does go to the heart of the vision that we need to have to be able to actually introduce change into the way that our society is addressing our aging population. So as Luke pointed out, honor your father and mother is one of the 10 commandments. It's the 5th commandment. And on the face, it makes a lot of sense. In the Talmud, it explains a little bit more deeply what does it actually mean, and in addition to what we would say is honor, meaning that we speak well of our parents, we don't interrupt our parents, we don't do things to dishonor them, there's another piece to it that's important for us to understand. So here's what the Talmud says. It says, in very brief terms, what does it mean to honor? To feed, give drink, dress, bring in, and to take out. So that's not something you're doing to your 35-year-old parent or for your 45-year-old parent. That really is clearly addressing an older parent who needs your help, either due to illness or age. And that's the heart of what this commandment, this mitzvah is. I want to mention also in later times many commentaries on what this means and how we're supposed to understand it. And I want to share something that comes from a Spanish Jewish commentator from the 13th and 14th centuries who wrote a book where his goal was to give the root reason why any of the commandments come. Not what you're supposed to do, but why it's there. So about this, he said the following. The purpose of it, ultimately, is to acknowledge and return kindness to people who are good to you. And we learn this first with our parents, because it's easy to ignore your parents, but to recognize that all of the goodness, all that they've given to you, to be grateful for it, to acknowledge it, to recognize it, and then to go from there to being able to look in the world and recognize and see all the other good things that people do to you, people who are good and kind and giving to you. And then in the Sefer HaChinuch, he takes that to the final step to say, from a religious point of view, to recognize all the good and the giving that the ultimate doer of good and giver, which is God, provides for you. But the reason for that is to create in ourselves that way of viewing the world and to choose to become a person who does good and who gives. And that's not limited just to one's parents. That's limited to how we engage with society. That, in the Chinuch's view, is the core reason why this mitzvah is given to people to do, this commandment to do. So how do we make it a societal level? I think it's two things. One is that the details of how you observe this commandment is if your parents don't have the funds, you're supposed to provide them, to feed your parents, to care for your parents, to take care of your parents. And another commentator even said, even if you have to go door to door to collect money to be able to do so, it's your obligation for your parents to do so. As a society, we have lots of older adults who don't have children who can do this. We have lots of older adults who don't have children or whose children aren't able to help them. And as a society, we have an obligation, therefore, to fulfill this for them, for all of our older adults, as a baseline. And that's just the baseline. But the bigger thing, I believe, is that to recognize, and this was in the video, to recognize the enormous good that everybody that came before us did for us. The city we live in, the community that we have, the wealth that exists in this country, all of the society that we have, we didn't build. We've added to it. But those who came before us built, and we built on top. And that's the core message that we have to recognize, is that we're not doing anybody a favor. We're giving what is their due for all that they've done for those behind and when they can't do it themselves. And I think that's the message that we need to be able to carry forward.
Thank you, that was beautiful. All right, Carly, you're up next, and this is a quiz. Why is economic security when it comes to older adults, so important in 2026? What policy changes have happened? What's happening now where it makes this really an urgent issue that needs to be addressed?
Do I have to take this out or picks up?
No, you can take it out.
Okay.
Take it out.
Getting my workout. Thank you. Okay, since I went here for my PhD, I should be able to pull out some stats and really impress all of you. But really, just on a general note, even following from what we were just hearing, it can be really challenging to live in this world, whether you have the funding to do so or not. And so for people who are in precarious economic circumstances or maybe have saved up but now they're living longer than expected, it could really be one medical crisis, one rent increase, or just the general increasing costs without the fixed income increasing. That could make it really difficult for older adults to maintain quality of life. And so I think there's an opportunity for us to think about the potential that older adults have, think about all of those structures in society that aren't currently set up to keep them engaged, have people volunteer, give back, keep working as additional platforms for people to maintain that economic security. Right now, we're not set up that way, and so people end up retiring, outliving their savings, and not being able to afford the increasing costs. And so if they do have family to support them, that's great, but often they end up going to the social service systems. And the main challenge these days is that those social service organizations that have been able to pick up the slack and support older adults are also facing increasing pressures. It's not just that their funding has changed and they can't rely on certain funding sources that they used to have, but there's more people in need of that support. And so in order to keep pace, we need to not just keep putting resources towards the increasing needs and that widening gap, but go even further upstream and say, okay, something in the system is not working, that's creating these big holes where older adults or other people cannot survive. And so I think this is, you know, not just having philanthropy or other, you know, community-based organizations step in at times of crisis, but really changing the system earlier on so that people don't end up in crisis when it happens.
Thank you. So it's more of a systematic issue rather than individual failure. I want to pick up on something else that you said. You mentioned people outliving their savings. Eli, can you expand on that whole concept of your wealth span not keeping up with your lifespan?
Sure. So there was, in the old days, talk of a three-legged stool of retirement. There was Social Security was one leg, a second leg was pension, and the third leg was savings. So what happened decades ago was outside of the public sector, by and large, the pension piece completely disappeared. And a 401k is not a pension. A 401k is a form of savings. IRAs are forms of savings. A pension is when you retire, you will receive a certain pension every month. And when that leg went away, again, outside of a small portion of the economy, it left people with a two-legged stool, Social Security and savings. And as Carly pointed out, many people are outliving their savings, not because they didn't save, but because people are living much longer, and because life is more expensive than it was in a generation ago for older people. And so the result of that is that you have a one-legged stool, and that one leg is Social Security. The average Social Security payment monthly in California, I looked this up, in 2026, with the increase, is around $1,900 a month. That's the average. Women receive, on average, less, $1,600 to $1,700 a month in California, because interruptions in employment, working at lower wage jobs, all of those reasons. If you're in an apartment that you're sharing with your partner or your spouse, and one of them dies, then you're left with one insufficient Social Security payment. So you can easily see how the system isn't designed to actually financially provide a foundation of support for people as they age. And as people live longer, they're having more years of frailty, more years of need of services, medical services, social care, other kinds of care, and they don't have the resources to pay for it. And the system itself isn't providing those resources. And adding one more piece to that, just to give you the complexity that we see at GFS in LA, many older people live in rent-controlled apartments, which were built before 1979. So if you're on the second or third floor, there's no elevator. And maybe you can't take those stairs anymore. And there's no way you can replace that rent anywhere else in the city because there's not enough senior housing. So you understand that individually people find themselves so frequently trapped in a situation that nobody could find their way out because they just don't have the resources.
Thank you. I'm curious if beyond the average retiree, if there's a particular demographic, Los Angeles or nationwide, that's particularly vulnerable. Donna or Wendy, could you answer that? Maybe.
Oops. I'll go first while you're getting this thing right. So when you look at the demographic, people who are living in rural areas are more vulnerable because there aren't as many resources around, and they tend to have lower income. If you're looking across cultures, so almost most cultures like Latino and African American cultures, they're going to have more interrupted jobs. They start with lower paid jobs, so that's really a demographic that is very vulnerable. People who may have a history of mental health issues are another demographic that's challenging, or if they had chronic disability throughout their lifetime and as they get older, our system isn't ready for that demographic either. And of course, women, which was already mentioned, that because of interrupted work and also just in general making the usual 80 cents to the dollar. So those are kind of the demographics that I can think of.
And I'll add on, in agreement with many women find themselves one paycheck away from poverty, one paycheck away from homelessness. They may have children with special needs, and that begs the question of people who are already living with disabilities in our communities, who sometimes face unsafe conditions, getting in and out of transportation and getting accommodations at work. So they may be discriminated against on that account. And then I want to mention our veterans who come to Los Angeles from all over the country looking for help and services. And we know what's happening within the Veterans Administration right now that is shameful to those who have served us and kept us safe. And finally, I want to mention the LGBTQIA+ community, and especially those living longer lives with HIV and AIDS, who are surviving but may not be able to find jobs to support themselves and to find the kind of healthcare that they need to live longer, but also have quality of life in the meantime.
And that reminds me of one other demographic, which are persons with dementia. Because people are living longer with dementia, we have better systems, and people, if you start early, you may live longer, so that's also a very high demographic. And we're also seeing more dementia because people are living 80+.
And I would imagine too, those people are also more vulnerable to financial exploitation and abuse.
Absolutely, right. And in earlier times, because they may make, their vulnerability may show earlier than before obvious signs to the family, they may be more vulnerable to scams and things like that earlier on.
Very scary.
Yeah.
And just to make things more complicated, what happens when you're part of what we call the sandwich generation? You might be taking care of small children, maybe college-age children, children that are having a hard time finding their first job, and then you have older parents you have to take care of. That's not only physically taxing, but it has to be financially a strain.
Yeah, you're getting a double whammy. So the sandwich generation, which is very common, and sometimes people call it even a club sandwich, but you have you have a younger or young adult, and then you have your older relative on the other end. And in between, you are probably at your prime working age, which is usually about 45, 50. Well, that would be your prime income age. And you're trying to work, but because of the pressures on both sides, the people in the sandwich generation are more likely to leave the workforce for a while to try to balance this whole thing out. It's like, okay, maybe I might be able to find childcare, but I can't find respite. I can't find adult daycare, so I'm going to have to leave the workforce. So now they leave the workforce at 45, and this is where her expertise will come in. You're going to be gone not a year, not 2 years, probably closer to 7 years. Now, how old are you now? You're 52, and that's considered an older worker.
Age 40, Donna.
Oh, well, I know that 52 definitely is. So at 40, you're an older worker, so try to get back into the workforce at 50-something. How hard is that?
Very hard. Impossible for many, difficult for all.
Yes.
At best.
And that's where the finances, so you're not having that opportunity to have built your cushion on finances. You probably, on average, families will spend, now this is average, $7,800 a year out of their own pocket. This is not covered anywhere else, just to help the person that they're caring for. Different ethnic groups, different cultural groups spend even higher, closer to 10 and more. So when you think about those, that's every year out-of-pocket expenses when you're doing all of your other expenses and you're really not working.
So when you're the primary caregiver, your retirement readiness is far away, if at all.
Yeah, you're in your 50s, so you've got 15 more years before you can even collect Social Security.
So if you want to continue working and you're looking for work, then you have an expectation that you will have the pride of self-sufficiency. But that unfortunately is not the case anymore. Whereas people used to work at one company until they retired and they got the gold watch and they got the promise of the pension. And now that has disappeared as our financial world has changed. And those who are most vulnerable are often scammed out of their savings. We hear about that a great deal. And elder abuse that occurs so that you would have to take off work to care for your elder if that occurred.
This sounds very bleak and very disheartening, but I'm going to ask Diego to explain to us how the U.S. Elder care system is going to come in and save the day, and how do you see how are we going to address this?
Wow. Trying to go from bleak. I think speaking realistically, unfortunately, our elder care system, and here I'm thinking of healthcare system, legal system, workforce, is really not prepared for the changes that are necessary. If you look at the legal system, for example, it was only in the 80s that the Department of Justice opened up a section that focused on elder abuse and elder fraud, and its funding has not increased. I'm not certain off the top of my head whether its funding was cut recently, but certainly its funding had not been increased in a number of years. When you look at the legal system, at our organization, when we represent older community members who have been the targets of scams and fraud, our ethical rules are not designed to allow us to address those issues in a comprehensive, holistic way that allows us to work with caring family members and other community members to meet the need. Our ethical rules require, for example, that we form one attorney-client relationship with the individual that was impacted. If that individual is living with dementia or Alzheimer's, it becomes incredibly difficult for us to be able to advocate on their behalf without essentially bumping up against or potentially running afoul of the ethical rules. I know we're going to talk about the workplace, but one other area in addition to the workplace is even work experience by way of volunteerism. Our systems are not built in order to facilitate folks to volunteer organizations, paid or unpaid. If you look at most volunteer programs, they're clearly targeting younger community members by way of their literature, the way of the photography and images used in that literature, and there is very little time, energy, or infrastructure building to support older community members who are looking to retrain and gain new skill sets to re-enter the workforce.
Are our current immigration policies going to have a effect?
They are already having an effect. There was a wonderful piece done by Marketplace. If you listen to that show, you can find it online, that profiled a care facility, I believe it was in the Midwest, where various of their workers have either been detained by ICE or they're too afraid to come in to work because of ICE detentions. Now, it's very important to understand these are individuals who are in the United States lawfully. They are not undocumented. They are lawfully present. They have work authorizations. And I have the numbers here because I'm terrible at keeping track of numbers. Somewhere between 15% to over 25% of healthcare workers and nursing home facilities are are comprised of individuals, the workforce are comprised of individuals that are lawful immigrants to the United States. So if we have immigration practices that are preventing people from coming to the US or are leaving people too afraid to work in those workforces, it's gonna have a serious effect on care of older individuals. And I just wanna note one other statistic. It says that there's a 10 percentage point increase. When there's a 10 percentage point increase in less educated immigrant labor force, there's a 29% reduction in institutionalization for adults 65 and older, and a 26% reduction for adults 80 plus. So this has real consequences on our community members.
Sure, and it probably increases the cost of healthcare. And when people can't pay for healthcare, Eli, maybe you can tell us, like, how does the cost of healthcare correlate with the number of people that are becoming unhoused in the United States right now because of these issues?
So there's a couple of different pieces of that. One is that hospitals have long been accustomed to providing uncompensated care for people who can't afford the care. However, under current policy, that's going to be harder for them to actually be able to recoup those costs. And I have heard from people in hospital systems that are quite concerned about how they're going to financially be able to continue to do what they've been doing. The second piece, though, is somebody who has healthcare issues, and how is that, and how, if they can't afford it, they don't have access to care, what do? They don't get care. What they do is they don't get care. And many times for older adults in particular, homelessness risk is triggered by a health crisis, a cancer diagnosis that then ultimately leaves them without income and ultimately leaves them without an ability to have a roof over their head. Individuals who are on the streets with chronic disease can't manage those chronic disease. If you have diabetes, you're insulin dependent, where's your refrigerator? Just as a basic thing, but other complex chronic diseases. And so the result is that when older adults do find themselves homeless, the mortality rate is unbelievably high. And the rapidity with which they medically become so frail is scary how quickly it happens, because they're not physically capable to be living in those conditions, even if they're living in their car. It's terrifying. Given the wealth of healthcare that we have in LA County, the starving person outside of the supermarket is the sick person outside of the hospital who can't access the care that's actually available.
Thank you. Donna, what happens when somebody's caregiver becomes homeless? Like, what?
Caregiver becomes homeless?
Well, yeah, I mean, like, if you're on the street.
Oh, well, I mean, and you know, it's interesting, you know, because in LA County, the fastest growing homeless population are older adults. Of that segment of when you're looking at older adults. And some of what's interesting is they're not taking data, but informally, when we've been trying to ask, like, how did you become homeless, you'll find a caregiving story behind that. Because they took care of their mom, their dad, their cousin, their sister, and then they moved into the home or they moved into the apartment, they quit their job, they didn't have health insurance during that time. They're now older workers, unable to find a job. They can't stay in the apartment that when their relative passes away, so they become homeless. They may not have another home, they may, you know, the home gets sold from under them. They didn't have, there's no, you know, we're not assuming everybody gets an inheritance. No, most of our people are actually just going to find themselves without having a backup place to live. And so one of the things that I've been trying to look at, and we're trying to collect through what we call the LACHA, is what are the rates of people who are homeless, older adults who are homeless right now, trying to really find out how many have that caregiving story. Because informally, when they started asking, they were always surprised that there was a caregiving story.
Maria, can I just add one thought to that? And Donna, you may be able to share more about this. But so many don't know that if you are on Medi-Cal, you may qualify for home care through a program called IHSS, In-Home Supportive Services. And it's funded with federal dollars and state dollars and county dollars as a formula around that. But the system in LA County and most of California is that the individual has to be sort of control the care. So they have to select a caregiver, they're monitoring the caregiver, they're signing off on hours, they hire, fire, and the county provides the paycheck and the county provides some health insurance for the caregiver. And the caregiver could be a family member, it could be a friend, it could be somebody who's qualified to do that work. But because it requires the care recipient to manage their own care, if the care recipient can't, because of dementia, because of behavioral health issues, because of other issues that they have, they can't keep a caregiver. If they're homeless and they've been rehoused, they may not have a network of people who they could draw on to find a caregiver. So then they're at the mercy of the registry at the county, which is what person at the county registry wants to work for that person who's just been rehoused from being homeless on the street. And so what you see is that many people who most need the caregiving can't actually access it, even though it's a benefit under Medi-Cal. There is a solution to this that they do in San Francisco County, where they have something called contract mode, where the county contracts with a provider to provide IHSS caregivers in the home with the individual, who can always choose not to take it and to self-manage their care. But that way, the individual has access to care that's not dependent on their functionality to be able to manage the care. There's been discussion in LA County around implementing a big pilot around IHSS contract mode. It's been shelved for the moment because of cost, because the cost for the county will go up. And given the current county financial difficulties, they're afraid to take that on. But it's an interesting gap that, when you are homeless or you've been rehoused from being homeless, how do you access that care that you may need? You may have some more insight into
I wanted to ask one thing about transitional housing, like the Holloway Motel in West Hollywood recently opened to allow 20 formerly unhoused people to access housing and supportive services on site. So it's a model program. It hasn't caught fire yet, but it seems like it may provide an answer to this dilemma of it's not either or, it's if it's and but. Thank you.
And to be clear, when generally when I speak about caregivers, because most people don't identify, I'm talking about the unpaid family member or friend who's caring. IHSS, the majority of the caregivers in-home support services, the majority of those are family members who are providing care to someone who's to a low-income relative. However, the majority of people, this is one of my favorite mythbusters, is that most people are cared for in America by their family members, not in an institution, in the community, and caregivers are the biggest economic engine of America. There's more money contributed through the efforts of family members than Medicare, Medi-Cal, and healthcare systems combined. So we are the economic engine, meaning families from across generations. And caregiving starts from the time that you've watched your parent care for their parent, or your parent care for your sibling. You've learned about caregiving. And so this is something that we don't even think about as caregiving. We say, no, that's my mom, that's my dad, that's just what I do. And so that, I think, is one reason that it's difficult to, we want to honor mother and father and our relatives, but the system kind of expects us to do it, and we aren't asking the system to change when we need to have some systematic changes.
Thank you, Donna. Eli, how does the Jewish community support long-term partnerships? How do they share resources with nonprofit organizations and then the government? Just like your organization, Jewish Family Services, how does that work?
So, myth busting. Government contracts don't pay for the full cost of what they're obligating the contractor to provide. I mean, it could happen, but it would be an accident if it does. In general, they don't cover the full cost of services. And as costs go up year over year, contracts generally don't. There are no COLAs in government contracts. And so providers, GFS, LA, ETCETIC, other service providers, constantly find ourselves with government funding for a huge piece of what we're doing, but it doesn't go the whole way. And how do we cover that gap? So that gap is covered by philanthropy. It's covered by foundations like the Arsenal Foundation and other foundations that step in. It's covered by our fundraising. It's covered, in our case also, we get some funding from the Jewish Federation for our senior services, which helps fill some of that gap. We also, at JFS LA, we serve over 1,300 Holocaust survivors currently are being served by JFS LA with funding from the Claims Conference, which actually that funding originates with the German government. And the average age is 89, 90. It's a very old and frail population. So, for example, in West Hollywood, we have a big program there. We have funding from the city of West Hollywood to make that program work. We have funding from the county of LA. We have our own fundraising. We have a little piece of money from the Federation. We have Holocaust survivors who we're serving out of that office where we're using funding from the Claims Conference. So we literally are braiding multiple funding streams together to be able to deliver the service, usually on the backbone of the government grant or the government contract. But it's absolutely imperative for community dollars to augment the public funding to be able to maintain services. And I will say the Jewish community has always been very, very generous in this regard, and it's what keeps us able to do all the work that we do. I'm sure ETCETIC is a similar story, and every other nonprofit in the community that's doing this work.
Thank you. That is illuminating, and I'm quite aware of how much your organization does, that ETCETIC does. But what challenges does the Jewish community face?
Specifically in terms of supporting social services or behavioral services or?
Well, I mean, what's going on? I know Wendy had talked to me about this. Like, it isn't like the Jewish community doesn't have its own issues that it's working with right now.
Well, I wouldn't say that they're isolated within the Jewish community, but there is a network of care providers and resources. For example, with Jewish Family Service and the other nonprofits that serve the community. But what is more problematic is the amount of anti-Semitism that we're coping with as a society in general, and the access to hate speech that is hard to control because of the First Amendment.
Right. So, do you think there could be some sort of programs, like Eli had mentioned the Holocaust survivors? Do you think it would be helpful if they shared their stories? Like, what do you think we could do to improve that? Diego, do you have any thoughts?
Yeah, so it's interesting because one of the things that we're very proud of at ETCETIC is the fact that along with JFS, we have a program that serves Holocaust survivors. We support in them applying for the reparations payments and maintaining those payments. But there was something else that we learned in the process of doing that work, and that was, as Eli noted, they are an aging population. And there were services that were needed in order to continue to protect the well-being, safety, and stability of that population beyond the reparations work. Whether that be elder law services, elder abuse prevention, securing public benefits. These days, sadly, it's a great deal of housing work and other issues. And so we started to work with the Holocaust survivors to address all of those issues. And here's the beautiful and interesting part of this, is that we then took all of that work and started to apply it to other, or make it available to various other communities. I'll give you one specific example. We had Holocaust survivors who were very much in need of estate planning services. And we slowly learned how to do that work on their behalf. And as a result of that, we were able to build an entire program that now provides estate planning services to various communities. And I bring up that story because for me, it is a wonderful example of everything that is done, for example, by an organization like Vet which has its roots in the Jewish community. We were founded by Jewish community members over 52 years ago, always had its doors open to all community members in need. And we've kind of grown from there to serve all these other communities, and we built bridges with these other communities. And I firmly believe that that bridge building and that inclusivity, it's what's helping people understand how anti-Semitism impacts the Jewish community and can lead to horrible impacts in other communities. Because as we've seen, some of our Holocaust survivor clients have told us, we fled our countries, my country, our countries, to come to the US to find safety. It is horrible and it is frightening to see what we are seeing here happening today, right? And so the lessons learned kind of reverberate out from there.
Absolutely. Thank you. Eli, did you want to add?
Yeah, I want to piggyback on something that Diego was alluding to, which is important, I think, for us to recognize, which is when we, as a Jewish, our first name is Jewish, when we as a Jewish community organization are serving the broad public through many programs that are not really situated in the Jewish community, we're representing the Jewish community and we're demonstrating Jewish values in action. And by doing so, we counter anti-Semitism and we demonstrate with actual facts and experience that people have what the Jewish community really is about, as opposed to what they might read or hear in some other context. And that's a really important thing, and I think it's an important role that our organizations play in addressing larger societal issues of hate and othering and things of that nature.
Thank you. Thank you so much for that. I'm going to switch topics here. And this is a very current issue. I just want to get your thoughts collectively on the new One Big Beautiful Bill.
You mean the ugly bill?
The ugly bill. What are the most significant positive and negative impacts this legislation has had on the average retiree?
I can start us off with some of the negatives, which are, we've talked a lot about some of those systems that exist, Medicare, Medicaid, or Medi-Cal here in California. It's great when you can rely on those, but given what the federal government expects, those safety net programs have to be drastically cut. And so when you look at a program like Medicaid, which, as we heard, actually does support some of that in-home caregiver support for older adults, already is hard to access, but you have to be, at a certain low income level. When they start putting more barriers in place and closing even the doors to that type of social support system, you end up with a larger group of people who are just on the other edge of that. They're not wealthy enough to afford their own care, to afford rising costs in healthcare and housing, but they also now cannot rely on a system like Medicaid to help cover some of those gaps. And so this is what we call the forgotten middle, and that is growing. There's many more older adults who are entering that demographic and will really struggle to maintain their quality of life given that lack of support.
Thank you, Carly.
To expand on the forgotten middle, one of the things is that when we forget about the lower income people, we are also impacting all generations. So it's not because the generational wealth that is lost when people have to use all of their savings, all of that you can't build to the next generation. Your home is going to be gone. Your savings accounts, your pensions, everything is going to be gone. And then usually those are the things that we tend to try to hold on to for our children and our grandchildren. You aren't going to be able to do that. And so it's not just impacting us as middle-aged, or in my case, an older adult. It's going to impact that 20-year-old and that 30-year-old, and then you're keeping people in poverty. And so you're building up a new poverty level, a new generation of people that aren't going to get out of poverty.
I agree. And we're at a tipping point now, as Malcolm Gladwell so aptly wrote years ago. We're at a tipping point where if you take away someone's food benefits, their SNAP benefits, and they can't eat properly, then they start looking for nutrition. Their health may fail. Chronic conditions may worsen. They may have to stop working if they had been working. So the spiral effect and the collective negative effect of taking away someone's health care and their in-home care and their food benefits, it compounds the damage that we can't afford to see continue. It's got to end somewhere. There has to be someone with the guts to stand up, as Robert Butler stood up before Congress and the White House Conference on Aging. And if that was 50 years ago, what happened in the meantime? So we need our champions to come to the aid of not just us who care about this issue, but to help educate others about these impacts.
Very good. Eli, did you want to add to that?
Well, I think that there's direct impact, and then there's an indirect impact, which has me really worried, which is most of the programs supporting older adults are not as damaged as other programs. But the state, I mean, Medi-Cal there's a huge impact there, which will affect older adults. But the state budget is going to be so impacted from so many different directions of cuts as those roll into implementation, that the available dollars to support older adults are now restricted. And so my concern is fighting for a smaller pot of money at the state, which already was hard enough, and now it's going to be harder. It's that collateral damage in a certain sense that I see.
But it's happening at the same time that the cutback in funding is happening at the same time that our demographic growth is exploding. As in the video, it said that, in 1980, there were 53 million people over the age of 80, and now there's I think it was 23 million, and now it's 58 million.
Yeah.
So the exponential growth in that population means that the burden or the request for services from Betzedek and Jewish funders has got to be in peril.
Yes.
Absolutely, if I could just jump in, absolutely, and Eli and I just witnessed something. It's not just at the state level, it's at the county and at the city level. So we were involved in responding to the fact that there would be massive cuts at the city level with regards to services via senior centers and other programs for older community members. And we just witnessed the consolidation of the LA Department of Aging into one larger agency, which really means that older community members, their needs will not be, they'll be swallowed up in the milieu of so many other needs and issues happening at the city level.
That's scary. It's frightening to think about leaving the workforce, given these circumstances and how quickly, one incident can change your whole trajectory. But imagining that if you're an older adult and so you're limited in your assets, you have a tight budget, but you're still working, but you can't make ends meet. Do we know anything about the percentages of people that fall into that category?
I don't really know, couldn't share a statistic on that, but I think it's important to recognize that the economic realities for many people in LA County and also for many older adults are more and more precarious as the cost of living has gone up.
Donna, did you?
I don't have the numbers. I don't want to give the wrong statistics.
But we've also seen, for those working older adults, that their healthcare benefits from their employer may have a higher deductible now.
Yes.
And then we have to talk about the pharmaceutical industry. Sorry, it's one of my, I think it's called my nemesis, that every time I go to the pharmacy, even regular medication that I take for arthritis has skyrocketed. And what happens to people who live paycheck to paycheck, or they have a higher deductible? So the pharmaceutical industry is something that we may want to address at a later time because it is a big, ugly mess.
Well, it goes with the big ugly bill. Diego, with the full retirement age officially reaching 67 years old this year, what specific corporate or policy shifts are needed to combat ageism and keep older workers employed? I need to know.
Yeah, well, I think we need to strengthen laws and practices with regards to age discrimination, ageism. I think we need to do a complete retooling of the provision of training and professional development opportunities throughout an individual's career and really look at it as different stages of growth and employment throughout a person's life. So it is not simply I am a lawyer and I practice this area of law, but rather what other skill sets, what other traits and strengths do I bring to the table? For example, I've been, as you noted in my biography, I've been in the nonprofit sector my entire life. If you work for a law firm, you typically sign a contract stating that by a certain age, and at many law firms, it's usually around age 60-ish, you will exit the firm. Hopefully, you are an equity partner or a partner of some sort, and so you can continue to benefit from the economic boom of working at a law firm, but there is a theory that at that age, you should step away from the practice of law. And I think that there are some terrible assumptions in that. And while I wasn't able to give, I think, an answer that took us away from the bleakness of what we are facing, but I think maybe now that I can, I think with the invention of AI and putting aside many of the concerns that some people have just for the moment, just for part of this discussion, AI seems like an interesting tool when it comes to older individuals in the workforce and training and retooling and taking on new tasks. If I, now an individual where my daughter can figure out, I don't know how to do this, but my daughter can figure out how to turn off the tracking on her phone, I don't know how to fix that, but I do know how to talk to Copilot and ask it that, I tell it, I want this, this, and this, and can you do it and make it look like this, this, and this, and it creates it for me. I don't need to program, I don't need to learn a new language with a computer or anything like that. It's helping me do that now.
So should I just go back to my office and ask AI how to solve all these problems?
But then, it might have some good ideas. They're good starting points, I'll put it that way.
Yeah. Okay, well, I wanted to ask Eli what roles he thinks that local governments, nonprofits, and for-profits in the private sector, what should everybody be doing to fix these problems before we ask AI? We'll ask Eli.
Well, I think the first step is to make it a local problem, because in general, I think in this country we've seen addressing issues of seniors as being a federal issue. The federal government's taking care of it. They've got Medicare, they've got Social Security, they've got Medicaid for nursing home care for low-income older adults. The Older Americans Act is all federal dollars. So the services that we're funded by the county and the city to provide the senior services, nutrition, home delivered meals, senior services, it's almost all federal dollars. The city puts in a tiny amount, and they've been cutting back on that. So I think that between seeing older adult issues as being a health issue or a federal issue, local government has abandoned a responsibility for addressing them. Now, local government can't spend the dollars that the federal government can spend, but it's not, I mean, as Diego noted, the Los Angeles City Department of Aging no longer exists. It's actually a piece of a larger department, and it doesn't even have a general manager level within that piece. I think that we need local government to accept some responsibility for addressing the needs of older adults in their community. I will say this, in the city and county of San Francisco, they have something called the Dignity Fund, which was passed. It is yet another increase in the local property, in the local sales tax. But those dollars in the Dignity Fund are exclusively for use to address needs of seniors in the city of San Francisco. And there's a process for allocating it, and if there's not enough money, then they don't allocate it. It's not a guaranteed thing, but they created a pot of money because there wasn't any other available dollars. And here, the city and the county just says, well, there's nothing we can do because we don't have the money and it's their problem.
We haven't talked about the digital divide yet.
I don't know if we're gonna have time to get into that, Wendy, but that could be a whole nother session, I think. But as long as you're bringing up innovations, I wanted to ask you, and the whole panel actually, what innovative programs, I was thinking about this the other day, about like zombie offices, that's a thing. Like what can we do with the assets that we have available to us now if we just, really try to problem solve?
We need our leadership to step up, our elected leadership and our corporate leadership, to step up and start paying attention to the needs of the housing industry that is focused on luxury housing and high rent areas that don't want people like that living in their neighborhood. There's a lot of pushback to rezone areas. I know where I live in West Hollywood, there's a tremendous outpouring of distrust of local government because we have no control over what the state is mandating. The state is mandating that you have to allow X number of ADUs to be built in your backyard, and you're not gonna have to put in any parking for those people. So that pushes residents currently living there out into the street with no parking. And some of it is illogical, irrational, and terribly upsetting to those of us who care about our older adults. So I think there's going to be a rethinking. We're going to be getting the vote out to mandate that our elected leaders pay attention and take the action that we need them to take to solve some of these long-term problems.
Thank you, and there's a mayor's race coming up pretty soon too, so.
I would say that, if we look at public, private, and foundation partnerships, there are innovative models out there, like the Dignity Fund, which is a great example. We can build more age-friendly communities. There's something called the village model, which there's a village here, but that's where
There are many villages here.
You have one in the
Many villages.
Fairfax District. There's one, I think we're trying to build one in Inglewood. There's Pasadena has one. So there are a lot of village movement, and that's really where
Westchester, there's also a synagogue village.
Right, yeah. And so the village movement allows the community more in a neighborhood level to work together to support the individuals within a neighborhood, but we could have more public-private partnerships that help with that case navigation, case management piece, that you need a hub or somebody to help with the volunteers, because you can't just kind of have people doing everything all by themselves. You need some leadership there. So that, I would say that you could build those kind of public-private partnerships. The Master Plan on Aging, I have to say, has a local playbook that really helps for a lot of cities. West Hollywood is a great example, and they got noticed award locally in West Hollywood for doing their local playbook of a master plan on aging. And we could try to implement that in every city and looking at all of the key areas. And then a lot of it has to do with wellness. You said, what can we talk about that's positive? we can look toward what can we do to build wellness facilities and places that really help us at every stage and not lump older people together as over 65. That's my other bugaboo, is you're 65, but my 65-year-old and an 80-year-old, we're not the same. They don't like the same music, they're not from the same generation, so you've got to break down our over 65 population, and then we can still work together at a local level, so.
Carly, did you want to add?
Yeah, I wanna mention a concept, la door vador, so from generation to generation. I think that intergenerational approach is really a key to making this an issue that everyone cares about and also finding creative solutions. And so we've talked a lot about the systems, how they're not working. Often it takes that local community level approach to make changes, and we don't always have older and younger people at the table sharing the ideas of what a better system could look like. And so that's one way I think that we can really make some improvements. I had another. Oh, okay. So in addition to the intergenerational community organizing component, I think intergenerational programs alone are a really good way to make use of resources that are available. You know, maybe a senior center sharing space with a daycare, and people can volunteer at different sites. It's just being creative. It could be intergenerational housing models. There's a lot of different ways that we could take what we do have and make use of the social capital, human capital, and then in addition to the systems that we have a lot of work to do to fix, there are still individual areas where we can make changes. I think of another Jarrow alum from the PhD program, Carrie Bernight, who wrote a book recently called Joy Span, and she talks a lot about how even in the most challenging times, you can still grow, you can adapt, you can connect with others, you can give. And so thinking about even on, a challenging week, during challenging circumstances, could you help someone else? Could you think of a way to connect with someone? And so when it all seems bleak, maybe also take a note from the individual choice area as well.
Carly, thank you for wrapping this up on a positive note. I now know there's hope, and we have some good ideas, and we have wonderful champions. Can you give this panel there's so much knowledge here, just in this room. And I want to thank our audience. I'm going to open this up for a Q&A, but I first wanted to thank you. I know that most Americans are glued to their television right now, and this is my little pet peeve, watching, I'm sure it's very hard to be a pro football player, but come on, it's just a ball game, and there's so many issues that deserve our attention. And thank you for taking your time out on Super Bowl Sunday and spending it with us and letting us think through some of these issues and reminding ourselves that we really have a lot of work to do. So, but I just wanted to open up. Is there any questions? Oh, yes.
Oh, Mike. So I appreciate what you said, that this focus, the local focus.
Could you use the microphone?
I appreciate that it's important to focus locally. I think that's a very significant issue.
People at home can't hear you, that's why.
Thank you.
Thank you.
Thank you. I appreciate the focus on doing things locally. That was very helpful for me in my work. I'm very engaged in this work in the Jewish community. But one of the things that I think is really important is the issue of caregiving is one issue that every single person in North America, and probably around the world, but at least in North America, has in common, whether they voted for this president or not, whether they think it's a big and beautiful bill or a horrible bill. We all are caregivers. Rosalind Carter said it perfectly. You are either a caregiver, you have been a caregiver, you will be a caregiver, or you will need care. And we go through that through our whole lives. And it seems to me that another way to think about this issue is to try to organize around the issue of caregiving. How could we do that? That's not a local issue, that's a national issue, I I think that that's a strategy that we need to think about and figure out who are our partners, and the notion of co-generation of generations working together to make this kind of change, I think is also a part of it, because we are all caregivers at some point in our lives.
Thank you for sharing that. I just want to mention, I think there's an important piece of that, which is that it is true. If you set aside the political division, we all have parents, grandparents. This is a human reality, and it's a bridging reality. And it is something that I believe can actually bridge divides that otherwise can't be bridged, and that's important.
So, the mic, it's okay? To address what you were saying about caregivers, there are, AARP did a study, for the last 10 years, the world, or the US market for caregivers went from 15% to 24% in 10 years. So it's staggering. So I have a question for the panel. By the way, the panel is fantastic. I learned a lot. Sorry that most people didn't show up, but it's an amazing panel that Lisa put together. But my question is, everyone in this room is engaged. What about 95% of Americans that are not engaged? I'm sick, I'm old, I'm gonna die. I mean, I feel that's the reality, because everyone in this room is looking for, I mean, I don't know if you're looking for a solution or not, but I'm saying everyone has an agenda to make things better. What about those people that they don't wanna make better, they don't wanna do anything? I think that's the reality. People don't want to do anything.
Thank you.
There's, I'm sorry.
Just a comment? Yeah, well, just a brief, I think people also don't have that conversation to frame it as something that can get better. And we do find ourselves in the echo chambers often, aging people talking to other people interested in the same issues. And this is where on a very small level, like talking to your neighbors about it, talking to your friends and family, letting people know that there's, you know, an anti-ageism movement out there is part of what helps this move forward.
Thank you. Thank you, you've been so patient.
Okay, yeah, hi, I'm in the life science industry, and AI is trying to speed up drug discoveries and cures and come up with faster treatments I know that there are researchers at UCLA and USC who are working on anti-aging PhDs to try to slow it down or even stop it eventually. I don't know if they can do that, but so you solve that problem if you can come up with faster cures, but then you have millions of other people who are going to be thrown out of work by AI, and they can't be sitting at home not working. We have to incentivize corporations and businesses to retrain these people who are thrown out of work. So, and then you have the complexities of the political and the bureaucratic institutions. So it's a complex society that we have.
That's interesting, because when those people don't have any money, they're not gonna buy any products and services, and then the corporations are gonna, it's a sort of the circle of life.
In LA County, they're doing a basic income pilot right now. There have been a couple of basic income pilots, and they have found that it actually generated funds for the economy. People started small businesses with their basic income beyond, and they were able to save beyond what their necessities were. But if you give a universal basic income, the few pilots that have been there have shown actually a boon for the economy and also for the family and the generations there. So we may want to continue those basic income pilots, get the data, everything is around, because I'm here, I have to talk data. And so there are, it went from 53 million informal unpaid family caregivers to 63 in the course of, since the last report, which was 10 years ago. So that informal and what you're talking about is family caregivers is the basic. That conversation, there are locally, you can join, I lead the coalition here in California, which is part of the national coalition for family caregivers. So there are a lot of coalitions that are coming together. Generations United, there's a whole bunch of coalitions that are working with that goal around family caregiving. And so if you're interested, please feel free to give me your name and I can get you at least on the mail list.
Donna, can you share the, from the California plan, can we send that out to people that registered?
The California Master.
Yeah, the
The
California
link,
Master
because they just did the, let's see, we're on year, it's a 10-year plan, we're on year. No, it's not that, I think it's 5. Yeah, and then it's gone down, and so they have a smaller plan this year, so there's a newer plan.
There's not 280 initiatives.
Yeah, it was 280. Yeah, there's something like 50 or something. Yeah, it's gone down to a reasonable amount now. But yes, the answer is yes, Mary.
Thank you.
Can I, on the question of how do you get people to care, for me it becomes a question of how do you get different people to care. And so now that we are seeing, for example, the impact of immigration policy on caregiving, there is an opportunity to bring in those who typically mobilize around the issue of immigration reform. You get to bring them into the conversation. For us at Bethesda, there's sadly a great deal of intersection between aging caregivers and employment rights issues. So we have seen an uptick in the number of individuals working in the care industry who are not being paid the wages that they are owed. And so now you can potentially get labor into the conversation of why do we need better laws, better healthcare systems, et cetera, to support aging communities. So I think it's helping people understand it from the perspective that they might, that is dominant for them, to help them understand why it's important for them to get involved in the issue.
Any other questions? Yes.
Yeah, just an observation, and this may not be just an observation, it might be true, but I think we need like a better sense of outrage. Like, the question would be, where are the caregivers? You don't send the caregivers back to Haiti or Mexico or the Caribbean or wherever they happen to be. You don't allow their wages not to be paid by greedy. And so I think we need to develop like was developed against the Vietnam War or boys and women's sports. I don't agree with that, but I think unless you get a sense of outrage, every person who gets a call from their grandmother saying, my caregiver was deported, you need to pick me up. Just developing scenarios, stories, things about generate a sense of outrage, because that seems to be the only thing that gets people to the government to do something. So just an observation.
Thank you. Diego, did you want to follow up?
Well, I was going to add to the list of outrage. One of the practices that we have seen recently when it comes to nursing home facilities, and it's connected to wage theft. What happens in caregiving in general, what we are seeing happening more and more often now is that there is a third party that contracts for purposes of sending caregivers out. And then there's the person, let's say, the family member who is helping provide care, and they have applied for, helped the care recipient apply for IHSS, or maybe they're paying out of pocket or something. And when there's wage theft, basically you're seeing this shell game of corporations, right? Where all of them say, well, we were only the agency that scheduled the time. We were only the agency that trained. We were only the agency, and nobody takes responsibility for the fact that the person was not being paid the wages that they are owed. So there's a lot of work having to, some version of what's often referred to as piercing the corporate veil, right? Like, how do you get to the person that's responsible and have them paid? Because only by doing that can you deter others from doing the same thing. So we also need a lot of anger over the ways that corporations are set up in this specific field, and changing the laws around that.
If I may add one comment onto that.
I just read an article recently, very, very alarming, about United Healthcare and how it was revealed that they were allowing an alarming number of senior patients in nursing care facilities to die rather than transport them to hospitals because it was much more expensive to actually transport them than to let them pass away from the illnesses or acute occurrences that they were experiencing. And so, thinking again about causes of outreach and outrage, think of the connectivity between these two words, and the profit motive within healthcare, and especially with the lens of senior healthcare, and in terms of policy reform and the intersection of policy reform and for-profit in healthcare.
Thank you, Lisa. Well, you have one more question?
Sure.
Sure, great.
So I produced a show called Caregivers Today. Hopefully it'll go to PBS. But we interviewed caregivers and we interviewed their caregivers and their patients. And then we had a segment with a psychiatrist or a psychologist or a therapist. But we also had a section of physical therapy. So people overlook the fact that we all have to get up and down. And a lot of people think, I don't know what people think, honestly, because everyone knows that woman suggested Rosalind Carter. I mean, if you look at Rosalind's Carter's, what she said, I mean, we're all going to be caregivers, or we are caregivers today. And so I don't know what people think being, they have to have proper nutrition. And they also have to have proper exercise, because people don't figure out that they're gonna get old. And as we get older and older and older, we're living longer and longer lives. So it is like a circular argument. I mean, I appreciate this panel, but it's a circular argument, and we have to get better slogans. Because all these slogans, all the credentials, we have to get, like Bill Maher said, you have to get right down to the core and give them the audience like a really cool slogan to motivate people. I mean, this is just my observation. It's not, I don't have a question, but sorry, I took up your time.
No, that's fine. Thank you. That's a great idea. And I always agree with Bill Maher on most things.
You have to get a good slogan.
We do. Listen, I want to thank our panel, Harley, Donna, Wendy, Diego, and Eli. I'm so glad we have this recorded because I think we captured a lot of really good ideas and a lot of statistics and numbers and all of that stuff. And thank you so much for coming. Thank you for sponsoring us. And this has been an amazing event. Small but mighty. So thank you.
Thank you.